Which of the following is the correct order of procedures for standard patient intake? And the intake is the beginning part of a visit when the medical assistant brings the patient in and starts doing history taking and vitals to prepare them for the visit. So in these choices, we have all of these things, but in different orders. So if you see, some of them have taking the blood pressure first, some of them have taking a medical history first, a pulse first, a temperature first, and then all of these things jumbled into different orders. So we need to figure out which is the best order to do it in for this question. So something to keep in mind is that this exam feels that you should do all of these steps, so the temperature, pulse, respiration, all the vital signs, prior to the medical history, because they feel that by doing so, that you have a better idea of how the patient's doing in their current state right now, and then you could get an understanding of the background of all the details of what's going on. Even though right when they walk in, you'll have just a basic idea of, oh, they're coming in for X symptom or for their well visit or whatever it is. So under that logic, we could eliminate option B, since the medical history is listed first here. And then of these three, taking the temperature first, taking the blood pressure first, or taking the pulse first, which one do you think should be done first? And a way to remember this is, you might remember during the pandemic when there are a lot of extra precautions in providers' offices, they would usually take your temperature prior to walking in to the visit, and some offices still operate this way now because that tells you a lot about the current disease state. Your blood pressure might be high, might be low, might be normal, whether you're ill, you're not, and that could also depend person to person. So maybe they chronically have hypertension, maybe they have hypertension because they're in a state of illness. There could be a lot of different reasons for that. But the temperature really will vary depending on if they're ill or not. If someone has a very high temperature, there's a reason for it. It's not because, oh, they just naturally have a fever in most cases. So for that reason, we will go with option A, taking the temperature first. And then you can move on to your pulse, respiration, and blood pressure, followed by taking the medical history.